After calving, the cow's reproductive organs have to prepare themselves for the next gestation. This means that the uterus has to return to the condition it was in prior to gestation. It also entails the uterus regaining its normal size. Bacteria that enter during the birth process have to be rendered harmless, and the mucosa has to acquire the proper structure to allow a fertilized egg to implant in it. Of course, the cyclical activities of the ovaries also has to be resumed. Normally, this entire process of change, known as involution, requires about 45 days. If one wishes to achieve the objective of 1 calf per cow per year, only 40 to 45 days then remain for a new, successful fertilization, after the 45 days required for the involution process have passed. Any problem that occurs during involution may therefore cause an immediate extension of the time between calving. The major problems that retard this process are retention of the afterbirth, acute or chronic inflammation of the uterus, delayed or inhibited function of the ovaries, and abnormal ovarian activity. In addition, some cows don't display any visual abnormalities nor any detectable problems upon rectal examination. Yet after 2 inseminations, they have not yet conceived pregnant. These are the so-called repeat breeders. Therefore, it's important that after calving, the farmer regularly checks the animals for signs such as abnormal discharges, and that he calls in the veterinary surgeon to give the animals a timely examination. It's advisable that a preventive examination is conducted 3 weeks after calving to determine any abnormalities in the uterus or ovaries which could lead to delayed involution. In any case, complete management should include examination of the animals in the following situations: 3 weeks after a difficult birth, when any abnormal discharge is noticed, when the cow does not come into heat regularly, when the animal has not been observed to come into heat within 50 days after calving, when the animal fails to become pregnant after 2 inseminations, and about 6 weeks after artificial insemination to confirm pregnancy. Thorough management by a practitioner is only possible when the farmer maintains reliable and accurate records of his animals. Fertility charts and special computer programs are available for this purpose. In this program, we'll deal with the most common problems chapter by chapter. These are retained afterbirth, uterine inflammation shortly after calving, chronic uterine inflammation, irregular estrus, anestrus, and repeat breeders. In normal circumstances, the afterbirth will be expelled within 6 hours after calving. If the afterbirth has not been expelled within 24 hours after calving, it's known as retained afterbirth. Research has demonstrated that such cows are usually in calf 15 to 20 days inconvenient as it leads to the extension of the calving interval. Moreover, these animals are more susceptible to uterine inflammation and infections. The causes for the retention of the afterbirth are not yet fully understood. However, there are indications that the disruption of the animal's defense mechanism may be the cause. Therefore, good hygienic conditions should be maintained during calving. This means that the calving stall should be clean and that clean straw must be put into the stall before every birth. All tools to be used during calving should be disinfected before use. And naturally, the hands should be washed thoroughly before an internal examination. Always use a lubricant during an examination of this nature. It's been demonstrated that a deficiency during the drying off period could also contribute to retention of the afterbirth. Herd metabolic profiles may indicate specific deficiencies which should be corrected. Animals with retained afterbirth should be treated in such a way that endometritis is prevented. The afterbirth should not be peeled away, as this only increases the likelihood of damage to the uterus. However, if it's indicated, all the sections of the afterbirth that are hanging loose can be cut away carefully. Administering antibiotics in the form of an intrauterine pessary could prevent uterine inflammation and could combat the smell that is so characteristic of a retained afterbirth. However, this treatment will not affect the expulsion of the afterbirth. As has been said, cows with a retained afterbirth run a high risk of endometritis. The farmer should therefore continuously check his animals for abnormal discharge. After the birth, it's normal for the cow to have some discharge for a few days. This discharge should be a somewhat watery mucus and may have some traces of blood, but it should not have a foul smell. If the discharge does offend, the animal probably has acute endometritis, which is an acute inflammation of the uterus that appears within 14 days after calving. Usually, a cow with acute endometritis becomes visibly ill quite suddenly, sometimes even seriously ill. Besides the foul-smelling, watery discharge, the animal has a fever and reduced appetite, and the milk production drops. Ultimately, cows with acute endometritis may die if left untreated. An internal examination will usually find an enlarged, flaccid uterus. These are pictures of an examination in a laboratory. This is the uterus of a cow with acute endometritis. A section of the afterbirth is still present. This uterus is 8 to 10 times larger than a normal uterus, some 40 days after calving. Acute endometritis is treated by administering the appropriate antibiotics directly into the uterus. This treatment can be supplemented by administering antibiotics parenterally. Owing to the fact that birth is not a sterile process, every cow will have pathogenic bacteria in its uterus after calving. These bacteria have to be rendered harmless by the cow's defense mechanism to prevent inflammation. If it appears that the cow's uterus is still infected 2 weeks after calving, this is defined as chronic endometritis. Chronic endometritis occurs quite often, in 10 to 35% of animals. The cows usually have a whitish-yellow discharge. However, the signs may develop no further than the discharge of a slightly cloudy mucus. An animal with chronic endometritis usually doesn't appear to be ill. An internal examination by a veterinary surgeon will be necessary to determine the nature and severity of the infection. A vaginoscope is a useful instrument for this. Without this instrument, some 50% of cases remain undetected. Chronic endometritis can be treated with an antibiotic that combats the infection. Chronic endometritis should be treated as soon as possible after being detected, so that calving intervals are kept at a minimum. Metricure has been developed by Intervet for this purpose. Metricure contains cefepime, a substance that acts against the major bacteria that cause endometritis. This antibiotic is presented in a special box which is infused into the uterus via a catheter. This ensures that a high concentration of the active substance is applied directly to the site of infection. A cow's uterus is cleansed naturally after calving with the onset of estrus. The result of estrus is that the increased defense of the uterus coincides with strengthened uterine contractions while the cervix is dilated. In this way, any unwanted contents are expelled. When chronic endometritis occurs for the first time in a cyclical cow with a corpus luteum, a yellow body on one of the ovaries, estrus can be induced by the prostaglandin analog substance prosolvin. Prosolvin breaks down the corpus luteum, halting the production of progesterone. This allows the estrogen-producing follicles to develop so that the cow comes into heat. In most cases, it's recommended that Metricure be administered 3 days after the prosolvin treatment. Pyometra is a special form of chronic endometritis. It's associated with the accumulation of pus in the uterus. As the cow does not come into heat, the cervix does not dilate, preventing the pus from being expelled. On the right you can see an enlarged uterus with longer-term pyometra. Compare it with the normal uterus on the left. The cow doesn't come into heat owing to the presence of a so-called persistent corpus luteum, a yellow body that doesn't disappear and therefore continues producing progesterone. Probably this corpus luteum persists because the inflamed uterus is no longer capable of producing sufficient endogenous prostaglandin to lyse down the corpus luteum. Therefore, the prime objective of treating pyometra focuses on lysing the corpus luteum. Prosolvin can be used for this purpose. The animal will then come into heat 2 to 3 days later. The uterus is able to expel the pus-like matter because the cervix is dilated and the uterine contractions are stronger. It's recommended that the animal be treated with Metricure afterwards. Irregular estrus can be detected by the greatly varying intervals between heat periods. For instance, 7, 11 or 14 days instead of the usual 21 days. If these intervals are 40 or 60 days, one can be fairly confident in saying that this is not a case of irregular estrus, but that the farmer has not observed the cow coming into heat. Irregular estrus is a symptom of cystic ovaries. One may speak of cystic ovaries when cysts are found on the ovaries from 40 days after calving. Cysts are large, non-ovulating follicles, some 2 centimeters or more in diameter, that are present for more than 7 days. The fact that these follicles do not ovulate is probably due to insufficient secretion of the luteinizing hormone, or because the LH peak occurs at the wrong time. There are 2 types of cysts: follicular cysts and luteinized cysts. In practice, however, these can be difficult to distinguish by rectal examination. Promotion of LH secretion should be the main objective in the treatment of cystic ovaries. This can be achieved by means of Fertigil. Fertigil contains GnRH, which stimulates the production and secretion of LH in particular by the pituitary gland. This produces the LH peak with the result that the cyst develops into a corpus luteum. This corpus luteum will break down naturally after about 16 days, so that the new follicular phase can start. The cow will then come into heat 18 to 23 days after the treatment. If this period needs to be reduced, Prosolvin can be administered some 12 days after the Fertigil treatment. This prostaglandin ensures lysis of the corpus luteum. The cow will now come into heat 2 to 3 days later. When cysts do not respond immediately to Fertigil treatment, Corulon can be administered. Corulon is an LH substitute that has a direct effect on the cysts and does not act through the pituitary gland as Fertigil does. A particular symptom of cystic ovaries is nymphomania, that is, a cow being in continuous heat. A cow with nymphomania is on heat almost constantly and is very restless as a result. She lows a great deal and continuously mounts other animals. These cows cause a great deal of unrest in the herd. Sometimes this disorder can also be recognized by a damaged tail root and twisted rump ligaments. The cysts in cows with nymphomania continuously produce a great deal of estrogen, which causes the symptoms of abnormal heat. Nymphomania can be best treated with Nymphalon. Nymphalon has a strong LH action and also contains progesterone. The progesterone counteracts the influence of the estrogen so that the animal soon calms down. When a cow has not been observed to be in estrus 50 days after calving, we refer to it as postpartum anestrus. The causes of postpartum anestrus can be widely diverging. Possibly the farmer has not noticed the signs of estrus. The animal is cyclical, but the estrus signs are very weak or very brief, so that it's difficult to observe them. The animal is not cyclical because the ovaries are not active. It could be due to cystic ovaries, as was discussed in irregular estrus. In isolated cases, the animal may have pyometra, the uterine infection without external symptoms. And sometimes it could even be the case that the animal is pregnant without the farmer being aware of it. Therefore, the proper diagnosis and treatment can only be established by examining the uterus and the ovaries, and a distinction also has to be made between cyclical and non-cyclical animals. When a veterinary surgeon has established that a cow with postpartum anestrus is cyclical and therefore has normally active ovaries, it's referred to as subestrus. Subestrus means that the animal ovulates normally but has no or weak estrus signs, or that the normal signs were not noticed by the farmer. Subestrus can be treated in several ways, depending on the stage of the cycle. We therefore distinguish three groups of animals. Animals with a corpus luteum, animals that have just ovulated, and animals that should come into heat soon. Usually, a veterinary surgeon can establish this by means of an internal examination. Cows with subestrus in the stage between days 5 and 15 of the cycle, and which therefore have an active corpus luteum, can be treated immediately with prosolvin. Prosolvin lyses the corpus luteum, stimulating the start of a new cycle. The animal will normally come into heat 2 to 3 days after a prosolvin injection. If it appears on examination that the animal has ovulated shortly before, the prosolvin injection will have to be postponed for a week. The reason for this is that a corpus luteum, which is sufficiently developed to respond to the prostaglandin, will only be present after day 5 of the cycle. If the cycle is in the follicular phase, the animal will come into heat naturally after a few days. Treatment is not essential in these cases, but thorough heat detection is. When estrus detection is a practical problem, subestrus can also be treated with prosolvin, but Crestar might be even better. Crestar can be administered at any time during the cycle, and one insemination undertaken blind at a previously determined time will suffice. This makes estrus detection unnecessary. Cows with true anestrus have no or minimal ovarian activity, and therefore they are not cyclical. Several circumstances can be the cause. Suckling of the calves, which plays a very important role in meat breeds. a negative energy balance in milk breeds owing to the high milk production, poor housing and lack of light, and insufficient feed. A corpus luteum may not be present on the ovaries of non-cyclical cows. This means that prostaglandins will be ineffective as there is no corpus luteum for them to act upon. Here Crestar can provide the solution, because Crestar acts as an artificial corpus luteum. Of course, aspects such as feeding and housing also require detailed attention to achieve good results. The Crestar implant contains norgestomet, a substance that acts in the same way as the progesterone produced by a corpus luteum to prevent renewed ovulation. Crestar increases the sensitivity of the hormonal system in cows that have inactive ovaries, in the same way as progesterone. Immediately after the implant is removed, PMSG is administered to stimulate the development of the follicles in the ovaries. The amount of PMSG given depends on the breed, age and circumstances. When the implant has been removed, one insemination at a previously determined time will suffice. It can occur that for no apparent reason, animals fail to conceive. These cows are known as repeat breeders if at least 2 inseminations have been unsuccessful. Thorough veterinary examination is always recommended in such cases. Sometimes signs of endometritis are found after a thorough internal examination, but other anomalies, ovarian abnormalities for example, may also be present. In cases of slight endometritis, the animals can be treated with Metricure 1 day after insemination. This will ensure that the uterus has recovered before the arrival of the fertilized egg 5 days later. Another cause of non-pregnancy is that the ovulation is late. This means that estrus is later than may be expected from standing heat. This is caused by retarded secretion of the LH luteinizing hormone. Therapy consists of synchronizing ovulation and insemination. This can be done by administering Fertigil on the day of insemination. Fertigil stimulates the LH peak via the pituitary gland, which ensures the onset of ovulation. The pregnancy percentage of repeat breeders can be significantly improved by treatment with Fertigil. In the program A Calf per Cow per Year, we've discussed the entire range of problems that can be encountered in the management and care during the reproductive cycle of cattle, and we've described the available solutions to these problems. As far as the management is concerned, we dealt with estrus detection, estrus regulation, and synchronization in Part 1. The most important subjects dealt with in this program with respect to health and diseases were retained afterbirth, acute postpartum endometritis, chronic endometritis, and pyometra. Irregular estrus and nymphomania. True anestrus, subestrus, and the phenomenon repeat breeders. Intervet International is the only veterinary pharmaceutical company that produces all the essential high-quality therapeutic products to improve fertility and reproduction in cattle. All these products make a significant contribution to achieving the objective 1 calf per cow per year anywhere in the world.